apresentação com todos os membros e todas as pessoas que estão nos ouvindo. Hoje é um grande prazer ter entre nós o professor Edward Fry, que é o presidente do American College of Cardiology, e o Dr. Chagas, muito conhecido de todos os senhores, que é um dos maiores representantes nossos, mediante a essa sociedade tão prestigiosa como é o American College. Dr. Fry, it's a great pleasure to have you here. I know that you are extremely busy and leaving your practice to come to Brazil and straighten even more the collaboration between SOCESP and ACC. This is a great honor for us and a great recognition. We really appreciate your contribution. You gave an outstanding lecture and very futuristic about wearables, digital medicine, and eventually how we're going to interact with these new tools. Some of the physicians come to me sometimes and ask if artificial intelligence will replace some of the physicians or perhaps some of the tasks that the physician was supposed to do. What's your vision about that? Should we close our eyes to the future in terms of AI, or should we embrace it?
Well, I think the simple answer is that we should embrace it. And as we also saw and heard, we know that cardiovascular illness and disease is growing rapidly. Our patient populations are aging. The prevalence of heart disease increases, even though we have great successes in terms of acute care. The unintended consequence of that, obviously, is to create more and more chronic care. And so we're going to be faced with the challenge of limited resources, greater responsibility, need to be more cost effective and deliver better quality. So to do that, we're going to need to leverage new tools and new ways of doing things. So I think although there may be some frightening aspects to incorporating the idea of digital medicine or artificial intelligence into one's practice, is it a threat in terms of compromising that patient-physician relationship, or is it a threat to one's livelihood in terms of their income and their work environment? I think, as we will see, as technologies are developed, the ones that will be successful will be the ones that help clinicians work better, smarter, and more effectively, and should be an aid. Now, as we also heard in one of the presentations, we have to be very careful about not being inundated with the information and not being blinded by the information that takes our attention away, eye off of the ball, so to speak. So that'll be the great challenge. We know that these concerns are real. We've seen them with electronic medical records, which should be an aid and assistance in what we do. But they do create great burdens. Learning how to manage those most effectively so that it's not burdensome and it's actually helpful is the great challenge. I think that we will develop, ironically, artificial intelligence tools to manage the artificial intelligence, and so that people can do things better. A great example in our practice today, we're now using artificial intelligence to read coronary CTA and to reduce the amount of time that the clinician spends with a study, which may take on the order of 20 minutes, now can be reduced down to the order of about 4 minutes. So now that clinician has 16 more minutes to take care of the patient, interact with the patient, do something else. So it actually becomes an advantage. And in the college, we're not moving away from the term artificial intelligence, but we're trying to reframe it as collaborative intelligence. So interacting collaboratively with the technology, again, focused on the care of the patient.
This is a fantastic vision. Thank you for sharing. And I totally agree with you. I think it's going to free us some time so we can have eye contact with our patients, we can touch, we can spend a little bit more time and understand about their needs, right?
And have some eye contact with our families.
Exactly, exactly. So Dr. Chagas, a question to Dr. Fry.
Yes, thank you very much, Dr. Abizaid. Dr. Fry, Abizaid told that we are very happy to have you here in person. And for the Brazilian Society and the SOCESP and also for the Brazilian chapter of the American College of Cardiology, it's a great privilege to have you here. The American College of Cardiology is an international society. And for the Brazilian cardiologists, what you can say about the programs and the opportunities that the American College of Cardiology can give to every cardiologist in terms of programs and also in terms of cooperation.
Well, again, it's a great honor to be here and to be part of SOCESP and to be part of the relaunching of SOCESP, hopefully on the backside of the pandemic, and that we're entering a whole new world. And the partnership between SOCESP and the American College of Cardiology is long-standing and critically important to hopefully the success of both organizations. As you well know, you are a leader in international cardiology and in terms of bringing together groups of cardiologists, whether it's the American College of Cardiology and other groups around the world. Your work has been very important. And I think it emphasizes that cardiovascular disease is a global problem. We know it's the fastest growing disease, non-communicable disease in the world. And as countries become more developed, it becomes a greater and greater problem. So we need collaboration around the world to be able to tackle this international problem. And the realities of cardiovascular medicine and cardiovascular science should be common to all. There's no difference in truth or science in one area of the world than the other. It's all the same truth and science. So the focus of the American College of Cardiology has been to our mission is to transform cardiovascular care to improve heart health for all in an equitable way, to increase health equity in everything that we do, and with that, with some basic values: health equity, patient-centeredness, professionalism, excellence, and a focus on education and learning. So at the end of the day, just like SOCESP, the American College of Cardiology is a learning institution. It's a learning organization, whether that is through formal meetings such as these, webinars, as we've seen through the pandemic, leveraging of technology to improve education and increasing access to education, clinical practice guidelines so that we have standardized ways of taking care of patients, appropriate use criteria for understanding what we should do and what is the appropriate thing to do in terms of leveraging outcomes. And then as we're seeing more and more, it's not just the science, the education, and the learning, but it's also the implementation. So trying to promote education with respect to non-clinical competencies. And I think these are shared values with SOCESP, the American College of Cardiology, and cardiology organizations around the world.
Yes, that's very important, and I think that we need to be closer and closer all the time. And for us, it's really a great privilege, Alexandre.
For sure. So, Professor Fry, I have another question. Besides all your attributes as a physician, as an administrator and manager, you also practice interventional cardiology for several years. And this is an area that we see a lot of advancement and incorporation of new technology. What's your vision as an administrator? And I know that you help to run a system with over 150 hospitals. How the whole system will be able to absorb all this new technology that adds a lot of cost into the system? They be fantastic. We get very excited with any new, TAVR system, mitral solution, tricuspid solution, and for structural heart, for instance, that is growing very fast. How do we absorb all this technology in a very responsible way? What's your advice? Should we incorporate heart teams in our hospitals to make a responsible decision? Because the resources will be limited, right. and we'll have to learn from you. And again, tropicalizing your information to Brazil, which is even a less resourceful country in terms of how we're gonna pay for all this new technology.
Yes, an excellent question, a great question. the great risk or the great caution is to be always chasing after the new shiny object. And I think obviously we have to put in perspective what is the end goal, what are we trying to achieve. And I think if we really use the quadruple aim as the goal in terms of improved patient outcomes, improved experience, cost effectiveness, and also professionalism, clinical well-being, and analyze all the new technologies that become available to us in that light, I think that's a good way to start, or a good guidance. You alluded to, as we become more and more dependent on technology, we have become more and more subspecialized. And one of the concerns that I have is that it's almost like the fable of the blind man examining the elephant. You know, if we're each looking at a different part of the puzzle, but we're not putting it all together, then we're not going to take full advantage of all of those technologies. We're going to use them in very inefficient ways. So even though we're asking our colleagues to become hyper-specialized and become so proficient at what they do, we still need to be able to take a step back and say, what is the overall impact of this, not only in the management of the individual patient, but also looking at it in the management of populations, because it's our populations and our countries and our health systems that have the limited resources.
Fully agree with you. Chagas, I think this was fantastic, right?
Yes.
And I think your contribution, your presence here means a lot to us.
It's
And
a great honor to be here.
the audience will be delighted. Thank you again.
Thank you.
Thank you,
Thank
Chagas,
you.
as well, for being
Eu só
the
queria
interface.
aproveitar para convidar os nossos colegas cardiologistas a passar no stand do American College of Cardiology, está logo ao lado da secretaria da SOCESP, e ver os vários programas que existem do American College para serem aproveitados pelos médicos brasileiros.
Perfeito, muito bem lembrado, e bom congresso a todos.
Thank you very much, Fry.